There is so much misinformation when it comes to birth control, especially the worry that a lot of people have that birth control could affect their future fertility. I talk to patients about this all the time. I was recently talking to a 20-something-year-old patient that had just finished freezing her eggs as a preventative strategy, and she was asking when she could get back on the pill, if she should get back on the pill. She had a lot of concerns because there was a lot of buzz in her friend group of similarly aged women talking about just getting off of the pill to see what their body can do, because they were really concerned about everything they've seen online about being on birth control for too long and this potentially having a negative impact on their fertility. So I broke it down for her. This is a complete myth, right? Birth control does not negatively impact your fertility in the long run. And I want to break it down for you on how birth control is not just a powerful tool to prevent unplanned pregnancy, but it can also be a really amazing tool for managing your hormonal health. In the case of birth control that prevents you from ovulating, and that's how it prevents an unplanned pregnancy, once you stop taking it, your natural cycle should resume. It could take a few months for certain patients, especially if they have been on really long-term hormonal birth control suppressing the ovaries. But in general, your cycle will start back up. I think a lot of confusion stems from the fact that sometimes when people have been on it for the majority of their 20s and 30s, they may not be aware that their cycle pattern has naturally changed. And so there is this effect of masking that, but that's not necessarily a bad thing. I actually think of birth control as being protective for our fertility in a lot of cases. The pill, the hormonal IUD, other types of contraceptives can lower the risk of conditions, gynecologic conditions like endometriosis or recurrent ovarian cysts that can cause a lot of pain and sometimes require surgery, and that can impact our fertility. We know in the long run, the pill can also improve our gynecologic health by reducing our lifetime risk of ovarian and endometrial or uterine cancer. In the case of women with PCOS, birth control can be a game changer. We know that some of the hormonal imbalances of PCOS are marked by increased levels of free testosterone, and this is often the culprit with the excess hair growth and hormonal acne and male pattern balding that we see in a lot of patients with PCOS. We know that birth control pills containing estrogen specifically can increase the levels of sex hormone binding globulin in our bloodstream. This is a protein that can actually bind free testosterone, lowering the levels of free testosterone and therefore improving some of these bothersome symptoms. Combined contraception with estrogen and progesterone can be really helpful in the case of women with PCOS and irregular or absent periods. It can protect their uterus from an unhealthy chronic buildup of their lining that could one day predispose them to uterine cancer. And I'm sure that this post is going to get comments like, I tried birth control, I hated it, it was horrible. I'm not suggesting that everyone has to take it, but I think if you had one bad experience, it's important to know that there are so many different formulations, even within the same type of category, whether you're talking pills, patches, IUD, implants, the ring. There are different types of progesterone that can be used in combination with estrogen. So if you have side effects to one, switching to another form might be the key to finding the right fit for you. I'll give you an example. There are third-generation progestins like Norgestimate or Desogestrel. These were designed to have fewer effects on cholesterol levels and other metabolic effects, but we know that they still have some pro-testosterone-like activity, and this means it's not necessarily the ideal form for someone with PCOS or hormonal acne. Fourth-generation newer progestins like Drospirenone have an anti-testosterone effect, so they can actually help with the acne, the water retention, and the common signs and symptoms of PCOS. So examples include birth control pills like Yasmin, or Ocella, and this is why that's often our first line choice when we're prescribing birth control for patients with PCOS. Bottom line takeaway is that birth control does not harm your long-term fertility, and in many cases it might even be protective. It can also help with symptom management for conditions like PCOS where you have a hormonal imbalance. And if one type doesn't work for you, there are many different options to explore, whether you're talking the pill, patch, ring, IUD, or injections, and there are many different formulations even within those different methods. I'd love to hear about your journey with birth control in the comments if you're comfortable sharing and how you found what works for you.